Two things when the pandemic was declared early in March that Mesh AI was really helpful, the scheduling platform. One was we needed to figure out um, who was on shift in the next 48 hours in departments that will be patient facing, that will need PPE, fit tested for masks and equipment to protect themselves. And were they protected? Were they recently fit tested? Were they ready? So essentially, the question was: are the people coming on shift within the next 48 hours? Uh, would they be protected even if we had the equipment for them? And it was a few clicks of a button, and we literally sent. We had a list of who was going to be working in anesthesia in our ORs and the ER and ICU, and we matched it to our last fit tested date. We actually, I think, asked Mesh AI to add the last fit testing date to the schedule, so and when it expires, so we would know if somebody's working in anesthesia and they're not fit tested, then they are sort of a rule that they need to be fit tested. So we were able to reach out to those people and they appreciated it. And because, it was not that simple, that was one. The second thing was when the pandemic broke out, we also decided that our medical team structure would change. So it was not that it's a service of family practice and practice of internal medicine and anesthesia. We literally had to go towards one person in the building per service, and then increase that to two people if our volumes increased, and to increase to three people. So it would be internal medicine 1, internal medicine 2, internal medicine 3. And we were able to build those teams within Mesh AI, restructure our current structure to decrease the number of physicians in the building, and it was proportionate to the volume increase. So our pathways built that in. So after the first 3 days, when we built this up, um, human resources planning for physicians became pretty boring. Every time I was asked at the command center table any update, I would say no, because the system was watching over it rather than again, we were watching over it, but we knew that if there was some unfilled shift, something, it will tell us. And if we had to upstaff, it was easy to open a line.